Canada was not as well prepared to face the pandemic as it should have been, had the stockpile of emergency equipment been better managed, and if a long-term solution had been put in place for healthcare workers, such as nurses in Indigenous communities. If there is one overall lesson to learn from this pandemic, it's that government departments need to take action to resolve long-standing issues and to see the value in being better prepared for a rainy day. Thank you. I'm now prepared to answer your questions.
Thank you, Madame Hogan. We will now go to the floor and the phone for questions. Please state your name and your media outlet, and we'll stick to the standard model of one question and one follow-up. Operator, do we have any questions on the phone?
Thank you. Merci. Please press *1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. Our first question, Ryan Tumulty, National Post. Your line is open. À vous la parole.
Yeah, good afternoon. I'm wondering, in your report, you highlight the problems with the national stockpile. You mentioned audits in 2010 and 2013. Was there any work done after 2013 to try to address these problems, or were they, systemically ignored all the way until last year?
So in your question, you referenced some internal audits that the Public Health Agency of Canada had completed, the first back in 2010. The department did a follow-up of that in 2013. That follow-up audit found that some action had been taken, but most of the significant findings had not been addressed. When we came in to do our audit, we found again that those problems remained outstanding. They were items like determining the needs assessment, so how much basic equipment should be in the National Emergency Strategic Stockpile. They hadn't addressed the issue on the IT systems, on how to better manage them. So at times we saw that items, expiry dates were not tracked, and hence action could not be taken. And so those longstanding issues are really what resulted in the National Emergency Strategic Stockpile not being prepared to deal with the increase in demand when the pandemic started.
Provinces are, of course, responsible for healthcare here. Was there adequate conversations between the federal and provincial governments over what might be required in an emergency? And was there adequate, coordination of what was in the federal stockpile versus what might have been in provincial stockpiles?
So you're absolutely right in your question that provinces and territories are responsible for the management of healthcare services, and that includes managing their own individual stockpile. So each province and territory has a stockpile that they should turn to first in the case of an emergency. They then also have to try and procure equipment to add to that stockpile. When they can't meet those needs, that's when they turn to the National Emergency Strategic Stockpile managed by the Public Health Agency of Canada. So at the beginning of the pandemic, what we saw is that there wasn't a very good sharing of information between the provinces and territories, but we definitely saw that improve throughout the pandemic. So they came to the table to discuss what was in provincial and territorial stockpiles, what their emerging needs might be, how their own provincial guidelines might influence their needs going forward. And so there was really an evolution throughout the pandemic, but at the beginning, it wasn't as effective as it should have been.
Operator, do we have a second question from the phone before going to the floor?
Thank you. Merci. The next question, Marieke Walsh, the Globe and Mail. Your line is open. À vous la parole.
Good afternoon. Following up on Ryan's questions, I'm sorry if I missed this in the report, but I don't see anywhere in the report an accounting of exactly how much, surgical masks N95 were in the federal stockpile, say on March 11th, when the pandemic was declared internationally. Do you have that information? And if so, can you share it?
So as you can imagine, our audit started in very recently, actually, a few months ago. And so we weren't able to be present to be able to count what might have been in the stockpile in middle of March. What we found as we started to audit was that deficiencies in the agency's system were such that it didn't have complete and accurate data about what was in its stockpile. And so we did make a decision to stop looking at what should have been there and what all those deficiencies might identify, and focus on how the government reacted and tried to overcome the deficiencies. But it was clear that the stockpile at the beginning of the pandemic was not sufficient to meet some of the earlier requests that were received in February and March from provinces and territories.
Thank you. So just to clarify from that, there was so little information from PHAC that your auditors could not establish those baseline numbers. I understand you obviously weren't monitoring in February 2020, but you couldn't get that clear information in retrospect. Is that what you're saying? And can you explain then if the stockpile was at all functioning how it should have been?
So what we found is that the quality of the data was such that we couldn't rely on what the agency estimated was the stock on hand, and hence focused on, when it's bad, let's not focus on how bad is it and why did it get to the situation it got to, and focus on how to move forward. What we did see, however, during the audit is there were officials had told us, and we reviewed documents that clearly indicated that budget constraints had impacted the agency's ability to determine the needs assessment, so assess how much should be in the stockpile, but also to fix its system or to even acquire goods as they may expire or be used coming out of the stockpile. So it really wasn't a reliable starting point, and hence why we didn't give an accounting of what was in the stockpile before the pandemic.
Thank you. Going now to the floor.
Thank you. David Aiken, Global News. Good afternoon. Before the pandemic hit, the government had clearly already failed, as you've noted, in not preparing that stockpile. That aside, I wonder if you have an opinion about how the government writ large reacted once it recognized it needed to quickly procure equipment. We have 3 government departments, agencies. They all responded in different ways, rewriting processes, changing rules. You note that helped procure equipment, but I wonder if you could put a little color. Was it a good job, bad job, creative job? What's your thoughts about how the government responded, broadly speaking, to the objective of now we got to find PPE and find it quickly?
So you're absolutely right. The National Emergency Strategic Stockpile was not prepared to respond to a pandemic, and that was mostly because the Public Health Agency of Canada had not addressed long-standing known issues. But what we did see was that the government was quite reactive and flexible, and we did see Health Canada and the Public Health Agency, as well as Public Service and Procurement Canada, come together and collaborate. So what we saw was the establishment of a long-term national supply and demand model to estimate needs, which had never existed before, the move to bulk procurement. PSPC took on some additional risks as it moved to that bulk procurement. The ability of the agency to outsource some of the warehousing to deal with the big volume that was being purchased and needed to be managed and then distributed. And then finally, we saw a scarce resource allocation strategy that was developed in order to help determine how personal protective equipment would be allocated when the purchases didn't meet the demands. So when you put all that together, that's a really good reactive response to a situation. What the government now needs to do is be better prepared and have that agility sort of baked into its processes as we look forward to the next health crisis or next national emergency that might be ahead of us.